Hello, this is Beth here, lead nurse educator at International RN. So I'm an experienced nurse here in the UK, and I have been teaching OSCE and doing overseas recruitment of overseas nurses for about 60 years. I also teach the CBT exam. In 2024 is when I made my own company of International RN. If you'd be interested in taking a course with us, please check out our website. Or if you want more tips and other videos for your OSCE exam or CBT exam, please check out our social media and YouTube channel. Okay, and as always, good luck with your exam. Hi, it's Beth here from International RN, and today we're going to run through some practice questions for CBT Part B, which is your section where you have the multiple choice questions with 4 answers. So what does LOLA stand for? Lifting operations and lifting equipment regulations, lifting objects and lifting equipment record, load objective lift equipment record, lifting operations load equipment regulation. This is the first answer. So when we talk about LOLA, this is the regulation of maintaining things in the workplace, lifting equipment. So that talks about things like hoists. So I don't know if you've noticed on the hoists in your workplace, there should be like a sticker or like a tag which has the maintenance date on it, and that's what LOLA's about. So those need to be checked yearly. There should be someone coming around to do maintenance on those on a regular basis. So that's what that's talking about. What does AVPU stand for? Assessment, venous pressure unremarkable, alert, verbal, pain, unresponsive, alert, verbal, pain, unreasonable, alert, voice, pressure, unresponsive. So the answer to this is the second one. So the AVPU is something we should be doing as part of our vital signs to assess the patient's level of consciousness. So obviously the first one's alert, the patient's talking to you and everything. Verbal is when, we have to talk to them or maybe shout at them to wake them up. Pain is when we have to do some pain stimuli, so like the trapezium squeeze, and then obviously we have completely unresponsive. What is the normal GCS score? 0, 3, 14, or 15? So answer to this is 15. So the GCS is made up in 3 sections, each equaling 5 points. So they should be scoring 3 lots of 5, which will be 15 for our normal alert orientated patient. And obviously GCS stands for Glasgow Coma Scale. When should the Abbey Pain Scale be used? All patients, patients unable to communicate verbally, patients with advanced dementia, post-operative patients. So this is for advanced dementia patients. So the Abbey Pain Scale is a way of sort of being able to ascertain these patients' pain who are unable to communicate to us verbally. So it's like a little quiz you fill out on the patient, looking at things like their facial expressions, what they might be sort of noises they're making, and that should help you ascertain their level of pain and help you to administer your analgesics. Obviously, it's very useful in these kind of non-verbal advanced dementia patients. According to the Equality Act 2010, which of the following are not protected characteristics? Age, disability, illness, religion. Apologies, I read them in the wrong order. But the answer is illness. So the Equality Act 2010 does refer to several protected characteristics, they call them, which are things people can't be discriminated against. So this is talking about like things like racism, discriminating against someone against their age. So there's several different elements which is covered there. Okay, but I hope you found this useful. If you want any more information on your CBT exam, we do have some other videos available. And obviously, if you're interested in doing our CBT course, please just send us a message. Good luck with your exams.